Lovely to see you.
Up, you're muted, Rick.
I just said I'm sorry I missed you. I'm on call in labor and delivery, but I'm going to participate as much as I can.
How are the babies?
Babies are coming fast and furious.
Is there a pandemic boom?
There seems to be a pandemic in very large patients and transports.
Hmm.
I don't know if we've really seen a boom because of the pandemic. There's plenty out there though.
Gary, are you all vaccinating kids?
Yeah, actually, we just started doing that earlier this week. Oh, I'm sorry, this past week. I was out on vacation for 2 weeks, but I did keep track of the notifications, and we have began doing that. Volume isn't as high just yet, but we're getting ready to really spin it off.
Thanks.
Yeah, so Eunice, Dr. Simrat and I we were internists. We were what's what I'm looking for here? Interns together. There we go. A long time ago. He's aged much better than I. So Eunice just finished up her third year clerkship in OB and was kind of been raving about what a great experience she had.
Eunice, did you get to see some babies?
I saw many babies and I got to deliver the placenta and hold the bladder retractor on multiple C-sections. It was a lot of fun.
Oh, that's amazing.
Yeah.
It's great having students with us. Really enjoy it.
Thank you. I enjoy being here.
Well, does anybody have any questions or comments or anything? We got a few faces that are not the usual staple.
Dr. Page.
Yep.
If no one has a question, can I have a fun question as a medical student?
You can.
How did everybody pick their specialty? Like, how do I know which specialty to go into?
It's the one that
That's
makes you
great.
smile. It's the one that makes you smile and the one that makes you feel good about coming in the morning to see your patients.
Yeah.
You gotta be able to whistle on the way to work and whistle going home.
Yeah, it really should be where you find joy. Yeah, much more important than where you find a paycheck.
Dr. Moore, how did you end up in your corner of the world?
Oh, well, I was thinking about that. So I ended up changing and going into internal medicine because I was wanting to do research on exercise intolerance and chronic disease. And so I wanted to have a really good foundation in chronic disease management. And, then later in life, when I went into doing, I realized that if you really want to be an exercise medicine doctor, which is what I really wanted to be, then I needed to do musculoskeletal fellowship as well. And so, I did a lot of training, but at any rate, I did things again. I agree with what's been said is you've got to like what you do. And it's the challenge that I think is for medical students is that your experience, particularly as a third year, and you kind of have to decide, you don't really have to, but you have to sort of decide by the end of your third year, is that it's very much colored by the teams that you're on and the people you're with, which is different than the work you're doing. And so you really have to try to remember what it is you want to be doing and not just who you like hanging out with. And so that's one of the, because you really, unfortunately, you have to make a not irreversible decision, but you have to make a decision really early in your career before you could possibly have explored everything. And so that's the challenge. It's a good question. What are you thinking of, Eunice?
Thank you, everyone, for the advice.
What are you thinking of doing?
Well, so I came to medical school. I think no matter what specialty I go into, I got into medicine because I was interested in health policy and advocacy. So no matter what I do, I'm interested in that. I came to medical school specifically because I was working at a nursing home before medical school, and taking care of the geriatric population made me realize that patient care is something I want to do for the rest of my life. So most of my experience comes from, geriatrics. So I've been interested in that. But then I just had the time of my life in OBGYN. So I'm like, oh, I don't know. Everything is so fun.
Dr. Quarles, I don't know if you heard the question, but it was, how do you choose a specialty? How do you decide where you end up? She was looking for advice. Do you have any?
Or like if anybody wants to share how they ended up, deciding, or if they had a moment when they decided this is what I want to do. I always think that's fun.
So going through we did rotating internships from the New York College of Osteopathic Medicine, and pediatrics had some interest, but OB, it gave me the exhilaration, it gave me the flavor, it gave me the excitement to have a little bit of control over something that you can see actually occur. 9 months is a long time, 40 weeks or so forth, but the process of being able to help women get through a very trying time, not all pregnancies are easy, but the reward was so remarkable and so sustainable. So sometimes there are good outcomes and sometimes there are bad outcomes, but for the most part, if you're there to help the young lady and women through the process to see what they can do for themselves, to empower them, to let them know that everything is going to be okay, it works well for me. So this was my passion. And moving forward, I asked a lot of questions. I prayed to find out which way should I go, what should I do. I asked a lot of advice, I asked a lot of consultations, and I was able to have some very good mentors. One was Dr. Josephine English, and one was Mildred Clark, and a host of others. But Dr. Josephine English was a remarkable lady. She was the first Black woman for the New York State Medical Society. She was an obstetrician gynecologist. She delivered Malcolm X, two of his children, and she always told me, you've got to always put forth, even when you're not feeling well, always put forth the best effort that you have. It's good for you, it's good for the patient, and you, at the end of the day, know you've done a remarkable job. No matter whatever happens, always be prepared to take on the unexpected. And obstetrics and gynecology has given me that platform and that latitude to take on the unexpected, because you never know what's coming through the door. And again, the exhilaration and the not knowing was always a good challenge. And that's what put me where I was, to make sure that I could do the best for the community, make sure I can do the best for the young ladies, empower them, and just give them a good prenatal care assessment and delivery process. So I was pretty fortunate to have good mentors, and that's what I try to do moving forward for all students coming through medical school, and all students who are in PA programs, any program we're in. I try to make sure that they have the ability to do the best they can for themselves and the patients. I know it was a mouthful, but hopefully
No, I love it.
A little touch there.
It's actually my hypothesis that I think OBGYN is so important, because it's my hypothesis based on my experience with mom groups on Facebook, that a lot of the anti-vax issue comes from poor experiences that women had while pregnant or in labor, where they really lost trust in the medical establishment. in that moment, there was some sort of trauma or something else that just sort of made them think that they had to be, their own advocate, but, beyond that, really sort of look out for themselves and their families in a different way. And so I think, that's such an important relationship. It's really important to have you wonderful people in those roles.
Eunice, it's Rick Summer in here. If you felt excited and turned on by your rotation through, with obstetrics and gynecology, come on back and do an acting internship with us. See if you really like it. If you have another area that interests you, do an acting internship in that area. It'll help you focus in on what you may want to apply for. But you really got to be ready to make your applications as you begin your fourth year. The early applicants are the ones generally that get the advantage for the interviews.
That's a good point. Thank you, Dr. Summerin, and thank you, Dr. Quarles, for sharing your story.
My pleasure.
Likewise.
Eunice, I would suggest you just be patient and go through your rotations and see what feels good. You'll also be talking to your classmates, but if they're on other rotations that you're not on, and I think you'll get I would say go with your gut. You'll get a feeling about what's the right thing to do.
Thank you, Dr. Snyder. That's the thing. Sometimes I think I just like everything a little bit too much.
Well, there you go. So that's why you become a family doc, right?
That's the thing, Dr. Page. Like every week I go back to so I'm at Binghamton doing my rotations, and every week we get to go to family medicine. And I really adore my family medicine doctor. I love how he knows everything. He reads so much. It makes me motivated to read a lot, which I don't know. I feel like before med school, I didn't do too much, which maybe I shouldn't be telling all of you that. But anyway, like every week I go to family medicine, and it's so cool to see like a wide range of ages and pathology and different life stories. And I love that when I go to OB-GYN, it's also a little bit unpredictable, but I don't know. I just like everything, but those two are really exciting right now.
There you go. Good.
Dr. Burkhart, it was lovely to see your face for a second. Eunice was asking how people chose their specialties or how they knew sort of where they should end up.
Yeah, I get that question a lot because ENT is kind of obscure. So, and I definitely figured out that I wanted to do a surgical subspecialty. It was kind of when I tell people is either you think you're a surgeon or you think you're not a surgeon or a proceduralist. If that's what gets you excited, then look at the specialties where you do a lot of things or you do more with your hands versus not doing that. And then I looked at the surgical subspecialties in a very dispassionate way. There was a book in the library, so choosing a medical specialty. So I'm like, okay, what are my choices? At the time, my dad was a general surgeon, and I thought, oh, I don't want to do that. You're in the ER all the time. I want something a little more controllable. And I felt that ENT was like that. And I loved the anatomy of the head and neck. What's one of the downsides? Getting to your surgical, getting to what you're trying to remove surgically is way more complicated than taking the tumor out. The anatomy of the head and neck is so complex that you can't just make a line, cut it open, take it out and sew it up. It never works like that. So that was a little frustrating, but I still enjoy the procedures, but I certainly have learned that medicine is 99.9% about human interaction, and a 10% it seems like, you have to be smart and know your stuff and be technically competent, but what sets you apart as a good physician is how you relate to people, no matter what specialty, I think.
What's kind of remarkable is that these are very impromptu discussions, but it's very candid, and it's a wonderful expression of why many of us love what we do, which has tremendous value for the students and for the residents. It really would be an interesting consideration to have something like this a couple times a year with invited, members to express why they love what they do as physicians, because we don't hear enough about the humanistic side of what we all love and why we do it. But we hear about, the pain and the suffering and how difficult life is. But when each of us reflects on why we really love being a physician, it's devoid of all of the garbage. And we smile like you are, Beth and David, and that's so important for the students to see and to instill in them a love of what they're going to become. So, in the future, David, if you agree with me, this would be something real interesting and valuable, I think, to the students to hear.
I think this would be fun. We could do this. All right. Now, on that very positive note, we actually need to move along. So we're going to we have a historical slideshow. So there's a bunch of slides going back 215 years. And then we have to give our sponsors their due. And then we will reconvene this meeting at 7 o'clock and we'll get the ball rolling.
Wait,
So
Dr. Page,
in.
I see that your wife is logged on, so I would be remiss in not also thanking Nancy Page for giving up her spouse during so much of this. And, all of you I know log on to meetings while you're watching grandkids, while you're up at the lake, while you're on vacation. And, it's such a gift of your time. And we really appreciate it. It really makes, like you said, it really makes the society what it is.
Well, thanks.
Thank you, Erica. Appreciate that recognition.
This is Dr. Steve, and today is going to be a good day. See, Dr. Steve uses HealthEConnections. Before, he relied on phone calls and faxes. His staff had to request reports and sift through disorganized files and incomplete medical histories. And patients would forget image CDs or medications. Now, his day runs smoothly. He can access a new patient's complete medical history, even allergies. After a referral to a specialist, he can see his patient's visit notes, and his staff can access lab reports immediately. No more chasing down information. It's all right at their fingertips. This is healthcare done right. Done with HealthEConnections. When healthcare providers use these tools and share information, it means smoother visits, fewer errors, and healthier patients throughout the region. Thousands of locations and 10,000 healthcare providers use HealthEConnections to collaborate, getting and sharing the right information at the right time to provide better care. Improved healthcare. It's here. HealthEConnections.
Hey folks, this is David Boza. I'm an attorney with the law firm of Norris, McLaughlin. We have about 120 attorneys in our firm, practice all areas of law, including healthcare. I happen to be in the healthcare department at the firm. Just so you know, we have offices in New York, New Jersey, and Pennsylvania. We're general counsel to the Society of Onondaga, and we're certainly proud of our affiliation, and have a lot of respect for the members of the society. Just a little reminder to members, everyone should feel free to contact me with any legal concerns they might have, healthcare or otherwise. Certainly put you in touch with other attorneys in the firm who practice outside of healthcare if your concern or inquiry is in that area or in a different area. Any healthcare concerns can certainly be directed at me. I'm happy to take as long as you need to run you through the process and give you good information and counsel that's necessary to guide you in the right direction, free of charge. In the event that we determine there is some sort of matter or action that you need to formally retain our firm, we have agreed to significantly reduce our hourly rates in order to accomplish that and give you the best legal services required. And again, that's healthcare or otherwise. We practice in tax, business, real estate, any other area of law. Another benefit that you have through your affiliation with the society is that we as a firm will facilitate a snapshot coding review of your medical records. What that means is if you provide us a sample of your medical records, we will coordinate with a certified coder. We'll determine what deficiencies you might have in your documentation. And with that, possible liability towards possible future audits. And we'll also be able to determine whether or not you are missing some portion of your documentation, which will necessarily lead to maximizing some revenue. So those are a couple of things that we provide. And certainly feel free to contact the firm and me whenever you have any legal concerns. Thank you.
Hi everyone, I'm Kate Sellers, Vice President of Charles J. Sellers Insurance Agency. We're proud to be a sponsor of tonight's annual meeting. Just a few words on who we are and how we can help Medical Society members. Our agency is endorsed by both the Medical Society of the State of New York and the Onondaga County Medical Society for insurance programs for members. We've worked with Medical Society members for over 70 years, providing insurance for physicians, their families, and their practices. We have special programs and discounts for members. We specialize in working with physicians and medical practices and can help you put insurance in place that will give you peace of mind that you, your family, and your business are all taken care of. We can assist you with personal insurance like disability, life, long-term care, home, auto, and umbrella, as well as all the business insurance your practice needs. On behalf of everyone at Sellers Insurance, thank you to the physicians and other healthcare providers here tonight for everything you've done for all of us and continue to do throughout the pandemic. We truly appreciate your personal sacrifices. Congratulations to all of tonight's award winners and to Dr. Dracker on his installation as president. Thank you and have a great night.
Am I on? I'm assuming, right? In the queue? Okay. Good evening. I'm Dr. David Page. I'm the outgoing president of the Onondaga County Medical Society. Welcome to our 2021 annual awards and meeting. Tonight, as we are celebrating our 215th year, we install a new slate of board members and honor our exceptional awardees. Just as a reminder to everyone, please keep yourself muted during the meeting. We appreciate your patience and flexibility. We're going to try to keep this moving so you have a chance to enjoy our keynote speaker and honorees. I'd like to recognize our sponsors for this evening's event. Without their ongoing generous support, this event would not be possible. So thank you. There we go. I ask that you now please join me in a moment of silent tribute to physician members who have passed during the past year. Wow. Thank you. At this time, I would like to call the business meeting to order. The item of business is election of officers and other members of the Executive Council, our governing body. Here are the new 2021-2022 officers and resident and medical student representatives. Here is the incoming Onondaga County Medical Society delegates to MISNY. Here are the incoming Onondaga County Medical Society's alternate delegates to MISNY. And here are the new County Medical Society at-large members. I will now entertain a motion calling for the unanimous approval of the entire slate. I have a motion for the unanimous approval of these candidates. All we need is somebody to raise their hand. There we go. Thank you. Now, if you're an Onondaga County Medical Society member, you can please vote now in the chat to approve our current slate of officers. You can simply say approved in the chat box. Good. I declare the slate duly elected. Congratulations to all of you and thank you in advance for your service to the society in the coming year. At this point in the evening, I'm now honored to introduce our keynote speaker, Mr. Troy Oechsner, Executive Vice President of the Medical Society of the State of New York. Troy joined the MSNY team as Executive Director in March of 2021. Before MSNY, he served for over 30 years in state government. About half that time, he served as Deputy Bureau Chief of the New York State Attorney General's Healthcare Bureau, where he litigated, if necessary, insurers, drug manufacturers, and pharmacy benefit managers for questionable and deceptive business activities. In the other half of Troy's career with the state, he served as Deputy Superintendent for Health Insurance at the Department of Financial Services, where he was the Chief Regulator for Commercial Health Insurance. Troy worked on numerous projects, including implementing the Affordable Care Act, negotiating the state's surprise billing protection law, passing and enforcing a wide range and variety of consumer and physician protector laws, including the prompt payment law, the mental health parity law, and the reproductive health coverage law. Prior to his retirement from the state, Troy was a partner at the Manette Law Firm, representing doctors, hospitals, and nonprofit organizations in a wide range of manners. Good evening, Troy, and thanks for joining us.
Dr. Page, thank you so much, and thanks to everybody here. Really, truly an honor to be with you. Congratulations to everybody who was just elected, and a genuine, heartfelt thank you to all of you for the work you've done during the past year and, well, going on 2 years of COVID. And I know I've heard the stories, and my sister's a charge nurse in an operating room, and the work that everybody does is just really impressive. And thank you for that. So I'm going to is asked to sort of talk about the future. What we're doing kind of going forward. I'm happy to talk about. We had a great year so far this year, where we did had a number of really impressive victories in the legislature and in our work on COVID. But I'm going to be focusing really more on prospective. So I'm going to share the screen, and hopefully this will work. Everybody see that? Hold on. And okay, start the slideshow. Can everybody see this?
Yep.
There we go. Okay. So, our overall goals, I won't read it, but, we really want to promote accessible, affordable healthcare in for New Yorkers, addressing inequities in the health system, and really to establish the organization both, on the county level and statewide as a major force, a thought leader, and really trying to effectively use our membership and trying to develop our non-dues funding. So our key priorities include increasing our membership, growing non-dues revenue, reducing unnecessary expenses, and really focusing on an enhanced advocacy of a proactive agenda. And I'll talk about each one of those real briefly. So in terms of what we're doing on increasing membership, we just hired this awesome new membership vice president, as well as you'll see in the box just below, a new director of physician payment and practice. And I'll talk about that in a second. But we're developing a sales and marketing plan, upgrading our member database, refining our value proposition, and revamping our website. In terms of one of those boxes was developing a membership sales and marketing plan. We've been looking and working with the membership committee. I don't know if anybody's on the membership committee, but at trying to simplify our dues structure. We have, I don't know if anybody realizes this, but just for individual membership, there are 27 different categories of membership that just developed over the years. Trying to simplify that as well as standardize it more for institutions and groups, and even engage the counties in ways that we can kind of come up with with some more simplified, standardized dues structure, not forcing anybody to do anything, just to be clear, but just having that discussion. Looking at our current processes, achieving a bunch of efficiencies. So we have a lot of manual work that I think both we and the counties do, trying to eliminate things that don't have a return on investments and add what matters, and really doing targeted marketing, including a real partnership with the counties, which we've been working on trying to develop a number of those ideas. In terms of upgrading our technology, I mentioned we have a new contract that we're almost done negotiating with an entity called Impexium. That's going to be our new member database, should really improve the member experience for all of you. It's going to be much simpler, easier. You can do everything from not just only pay dues, but see what kind of committees you're on or may be available to you, check out all different kinds of events, have access to CME programs, and a lot of different other places. And another big piece is that it was going to give all the counties will have access to this main database. So instead of having to call MISNY and we run a search, et cetera, on different questions, you'll have real-time access yourself to your own member information. We also want to revamp the website. We're actually just finished negotiating a contract with some folks today about doing some short-term fixes to this ancient, horrible website that we have that's tied to this ancient membership database system. But we're also going to be working on really upgrading it, putting it on WordPress, and really revamping our website. Working on refining our value proposition, sort of what it is that we do that really provides value to the members. I think we all know that there's a lot of practical resources and contact with your peers that we provide access to. We're obviously the voice of physicians in New York for vis-a-vis the state, and we protect your profession in a number of ways that we'll talk about, that maybe you know and we'll talk about, but both your credibility and your opportunities to advance your career. So some of those features include, we've talked about the advocacy work that we've been doing legislatively around Office of Professional. I won't go through all these examples, but as you may know, the Office of Professional Medical Conduct, the governor in the past has kept putting proposals to allow any complaint against a physician to be posted without any due process, even though 98+% of the complaints against physicians are found to be meritless. This could really ruin careers. We do a lot of work in the regulatory arena around easing prior authorizations. We've got a bill that we're proposing now to try to improve network adequacy requirements. So in other words, before an insurer can go out with their network, by strengthening those requirements, the standards that they use and the enforcement of those, it'll help physicians in negotiating. Physicians and hospitals and others. Vis-a-vis insurers, I think I mentioned we started a new physician payment in practice where we're pushing back on insurers. It's an amazing resource. We've got this great new person. Her name's Heather Lopez. I really encourage all of you to use her if you're having stumbling blocks, either getting paid and the runaround by insurers. I certainly dealt with a lot of that and worked with MISNY when I was at the Attorney General's office and Department of Financial Services on lawsuits and enforcement actions. But Heather is wonderful. We were obviously doing a lot of work on public health, vis-a-vis, on COVID. We were incredibly active, doing peer support with our peer-to-peer program and the Committee for Physicians' Health. We have a whole range of discounts on everything from insurance, like you saw Sellers Insurance, to a group purchasing organization. And there's no cost continuing medical education. And of course, we provide a huge amount of leadership development opportunities through our committee, through people, physicians providing testimony and doing advocacy work. Some new benefits we're considering, member-only news alerts, providing better online community where doctors can connect online in particular ways to talk about issues and share issues that they're dealing with. More networking and mentoring support, enhanced SOFI discounts for medical students with debt, and increased support for our counties. Now, growing non-dues revenue, I'll go through this really quickly, but we have a lot of great ideas regarding getting new grants, trying to use our House of Delegates and other meetings to leverage sponsorships and to provide new income from benefits. I'm just focused mostly on the grant writing now. We have a whole bunch of ideas. I'm not going to go into all of them. I'm happy to answer them, but on different grants with both public and private sources. There is a lot of money out there for different grant opportunities that will really benefit both physicians and patients. And we're looking, we're working on hiring a grant writer. Been interviewing people for it. We're getting pretty close, and we're going to hopefully expand our income that way. We've been doing a lot of work on reducing unnecessary expenses. We've already saved a bunch of money on our Long Island office by downsizing it. And we're doing the same in Albany. Going to be moving to a new location. We've been really trying to make the best use of virtual meetings, which will also save us money and is in many ways more convenient. Although we're still going to be having in-person, the plan is an in-person House of Delegates this year. And, of course, the AMA is going to be going live in person is the plan. Different ways of using IT and redeploying our staff by improving efficiencies. And we've been really active renegotiating equipment, supplies, and service contracts. Looking at our agenda, and what kinds of things we're doing, we have started some work on strategic planning. And we're working on a grant actually to get somebody to come in here to help us do some real strategic planning, which we haven't done in quite a number of years. We've been reaching out to a number of our coalition partners, Haney's, the Hospital Association of New York State, and Greater New York Hospital Association, the Healthcare for All New York Consumer Coalition of over 100 consumer groups, physician assistants, nurses, and others. And I don't know if anybody's noticed, but we've been in media a lot. Dr. Sellers, who's practices in Cooperstown and Cobleskill, we've had him really busy in the media, and we're really been working on focused issue selection, which I'll talk about very briefly in a second, and doing white papers. And some of the issue areas that we're going to be focusing on include fighting insurer roadblocks around pre-authorization and credentialing, promote to make those easier. And I'll just say, like, one of the things that's always really annoyed me about insurance companies is they put these prior authorization requirements in, and many doctors report, and I think it's really true, is that most of the time they're getting approved on these pre-authorizations anyway, and it's a huge hassle. We need to start putting their feet to the fire and making them not able to do pre-authorizations in instances where they're almost entirely approving them anyway. Anyway, that's just an aside, but we want to promote physician-led team care. We agree with the idea of team practice, but scope of practice needs to be all led by a team of that team needs to be led by a physician. We're looking at a number of different areas on insurance coverage expansion, which I can talk about if anybody wants. And then we've been pushing and working very closely with the new governor on getting vaccines more available through physician offices, trying to make them routine, the COVID vaccines. As I mentioned, improving network adequacy requirements, and really trying to push insurer compliance with a number of protections for consumers and physicians around mental health parity and prompt pay, among other areas. And then addressing some of the institutional physician concerns that many physicians have around non-compete clauses and excessive paperwork, et cetera. And of course, working on health equity issues. I mentioned COVID, insurance expansion, school-based immunizations. There's a lot more to talk about, but I'm trying to be brief and happy to talk about any questions, but I'm really excited to be here. I'm excited about our new NISNE leadership, some of the new staff we've brought on board, and just, really excited, Dr. Page, to work with you and the rest of the team in Onondaga County, and eager for your thoughts and ideas on what we could be doing better. Happy to take any questions or
You're muted,
comments.
David.
I'm sorry?
David is muted. He was talking.
Oh,
Yeah, I fixed it. Thank you. I don't know if anybody has any questions they'd like to ask Troy quickly.
if not, that's okay too. I lived in Syracuse for a couple of years. I clerked for a judge who had his offices in Manlius. He was Judge Hancock, Stuart Hancock. I don't know if anybody knew him. Direct descendant of John Hancock, and he was a character, a really amazing person, Old Navy cadet. And anyway, I miss Syracuse.
Okay, well, thanks again, Troy, for that great overview. We appreciate you taking time out of your busy schedule to share. And we've come to that point in our meeting in which we are honored to recognize those who have distinguished themselves with their service to medicine in our community over the past year. Our first award this evening is the Adeline Fagan Physician Service to Community Award. This award is named after a young physician from Lafayette who passed away from COVID-19. She spent her life helping others. Her parents, Jane and Brant Fagan, are with us this evening, and we welcome them. Tonight, we recognize Dr. Stephen Thomas, one of Central New York's leading and most authoritative voices regarding the COVID-19 pandemic. Dr. Thomas has been offering his perspective based on scientific fact of the pandemic, vaccines, masking, treatments, clinical trials, since the pandemic was declared a global outbreak in March of 2020. Whether it has been his regular appearances on local media, his presence on CNN and other national media outlets, or as a contributor to Forbes magazine or to other scientific journals. Dr. Thomas has shared his perspective on the pandemic with a style that translates well to round-the-clock media coverage. The Syracuse Post-Standard said of Dr. Thomas that he has been one of the most visible faces in the local fight to limit the spread of the coronavirus. As director of Upstate's Institute for Global Health and Translational Science, Dr. Thomas was key in bringing numerous COVID clinical trials to Syracuse, which afforded Central New Yorkers an opportunity to play a vital role in the development of COVID vaccines and treatments. We're honored to have you receive this much-deserved award, and would you like to say a few words?
Thank you very much, Dr. Page. I'm really humbled and extremely appreciative of the recognition by the Onondaga County Medical Society, and I'm also extremely thankful for the advocacy and support that the society provides to medical providers in Central New York. And to my fellow medical providers, it really has been a privilege to stand with you during this this pandemic, and I know that we have all tried throughout these 2 years to always make good decisions and to always do the best that we can for our patients and for our communities. And finally, to Mr. and Mrs. Fagan, I really appreciate the time that you spent with me today on the phone discussing Adeline. And I also appreciate the compassion that you showed to me as I discussed my own loss of a child. And I shared that information with you because I really wanted you to understand that this is much more than just a recognition. Named in Adeline's honor, it really means a lot more to my family and me. And I did not know Adeline, but I really wish I did. And it's just a real honor to receive this award this year. So thank you very much.
Thank you, Dr. Thomas. I appreciate it. And I enjoyed speaking with you today.
Yes, thank you.
Thank you.
Thank you, Dr. Thomas. Actually, it was very moving. This is just nice. The next award to be presented is a physician service to the Medical Society. This year is being presented to Dr. Seth Kronenberg. Dr. Kronenberg is a board certified internist. He is currently the Chief Operating Officer and Chief Medical Officer of Crouse Health. He is a member of the boards of directors of the Syracuse Community Health Center, Community Memorial Hospital, the Laboratory Alliance of Central New York, and HealthEConnections. He is the President and Medical Director of Crouse Medical Practice. Since the onset of COVID-19, Dr. Kronenberg has led the clinical and operational aspects of Crouse's response to the ongoing pandemic, providing daily briefings for both clinical and non-clinical staff and serving as a liaison between Crouse and the state and county governmental agencies. Dr. Kronenberg has collaborated with private and employed physicians during the crisis, including vaccination programs for the medical community and managing operational challenges caused by the pandemic. He has worked with the Onondaga County Medical Society to get community physicians vaccinated when there was not an existing path for physicians who were not affiliated with a hospital. Congratulations, Dr. Kronenberg, on this much-deserved award. Would you like to say a few words?
Yeah, thank you, David. Just a couple of things similar to what Stephen said. Really, global pandemic, no playbook, and opportunity for tremendous chaos and conflict. And instead, what we saw was cooperation and collaboration. So that's really a testament to the culture of the medical community, really unprecedented collaboration between hospitals, physicians, and EMS. And that led us through all the challenges we faced. Do want to just recognize the incredible team at Crouse Health, medical staff, senior leadership team, and all of our employees. And, similar to what Stephen said, it's really been my honor to work alongside the frontline staff, the doctors, nurses, respiratory therapists, environmental and nutritional services, who really put their lives on the line to serve the community. And I will also say we are very fortunate at Crouse to have had award winner Dr. Stephen Thomas to help navigate us through. So thank you to the entire medical staff. Just a quick thank you to my family, Paul Kronenberg for his mentorship, and then similar, Erica, to what you said before, thank you to my wife, Meredith, Emma, Sarah, Brooke, and Tess, my girls, for donating my time to the medical community. So lots of challenges still ahead, but it really is my honor, and I look forward to serving with our Medical Society physicians.
Thank you, Dr. Kronenberg. The next award this evening is the Jerry Hoffman Advocacy Award. This $1,000 award is named after Jerry Hoffman, a passionate advocate for local physicians for 33 years. This year, we present the award to second-year medical student Elana Sitnik in recognition of her achievements in activism. She organized a door-to-door COVID vaccination program in the middle of the pandemic. She attended the House of Delegates and participated vocally and advocated for the New York Health Act to cover all New Yorkers with insurance coverage. Congratulations, Elana. Would you like to say a few words?
Hi. Yes, thank you. I'd like to just take a moment to remember last year's recipient of this award, Dr. Fagan. I will not be able to learn from her in the clinical setting, unfortunately, but absolutely I'm learning from her story and heroism, and hope to honor her life and intend to honor her life by carrying on with the vital work that she was wholeheartedly dedicated to before her passing. I'd also like to thank the Medical Society for giving me this award. Thank you all so much for this recognition. Truly, it reassures me that I am doing exactly what I came to medical school to do. My decision to come to medical school is not one that I made lightly, but I understand the impact that physicians can have on policies that are really influencing the health of our communities. So it's been my pleasure to be involved with the Syracuse community, with MSNY, with the AMA, and this is really just the beginning for me. So I look forward to being a colleague of all of yours in the future and continuing to advocate for equitable and accessible healthcare. Thank you so much.
Thank you so much. And now our next award of the evening is the non-physician service to medical care. This year's recipient is Natrell Walker. Ms. Walker has been a nurse at the Syracuse Community Health Center since 2003. Throughout her 18 years of dedicated service, she has been allotted an opportunity to work in a multitude of positions within the organization. Throughout Natrell's nursing career, she has always demonstrated a passion for ensuring that all patients receive quality health care. In 2019, the Director of Nursing offered Natrell a position as the Clinical Quality Coordinator. In her new role, she felt that she could not only be the voice in the clinical area in which she was assigned, but now she could make an impact within the organizational structure to be the voice for her patient population. Natrell played an intricate role in Syracuse Community Health Center, receiving Joint Commission accreditation in 2020. In 2021, she and her successful team were responsible for SCHC receiving its FTCA deeming notice. Congratulations, Ms. Walker, and would you like to say a few words?
Sure. Good evening, everyone. I'd like to thank Onondaga County Medical Society for allowing me to be a recipient of this amazing award. I'd also like to thank my coworkers at Syracuse Community Health Center. I see some familiar faces on the screen here today. So much of what we do, we look at it as it's just day-to-day work. But for me, and I share this comment with friends, family, loved ones, and coworkers equally. Your job is what you do to support your family, but your work is what's ordained by God. And being able to practice in healthcare, it's a double portion blessing to be able to go to work and serve your community, serve your patient population, and do your work at your job. So, thank you.
Thank you. That was outstanding. The final award to be presented this evening is the Distinguished Service Award, the Society's highest award. This year's most worthy recipient is Dr. David Lehmann. He is an internist and clinical pharmacologist at Upstate Medical University. Dr. Lehmann founded House Calls for the Homeless under the auspices of SUNY Upstate in May of 2018. This program provides medical care free of charge to the homeless directly on the street and at area shelters. He has dedicated extensive amounts of time in service to academic leadership as chair of the Pharmacy and Therapeutics Committee at the Upstate University Hospital, chief of the Clinical Pharmacology Inpatient Consult Service, chief of the section of Clinical Pharmacology, the Departments of Medicine and Pharmacology. He has previously served as vice chair of the Department of Medicine and chief of the Division of General Medicine. Professor Lehmann has served as a practicing physician in Saipan Hospital Pharmacy, director in Kenya, educator and consultant in the development of a pharmacology curriculum in Nepal and India. More recently, has provided medical services through relief missions to Haiti, Ecuador, and Puerto Rico. With high esteem for all of your contributions to the health and well-being of all citizens, the Onondaga County Medical Society confers upon you the Distinguished Service Award for 2021.
I just want to say how honored I am to receive this. It came as a complete surprise to me, and I want to thank you very much. I've been here since 1994. I came here as assistant professor of medicine and general medicine. In 2018, I was a hospitalist, and I was doing straight inpatient medicine for 5 years. And what I was seeing was a significant minority of patients who would come into the emergency department. They would be seen in the emergency department and sent out with a prescription or whatever, see your physician. And these were patients experiencing homelessness. So I was taking care of a patient on the 6th floor over at Upstate. The guy was in there for IV 6 weeks because we couldn't get the guy out to a place because he was a heroin addict. So none of the services, home services, would take him for IV antibiotics. So he was stuck on the 6th floor, wasting the nurse's time, wasting, the patient's time, my time, all this stuff going on. And the amount of money that we're spending is the least of it. It's the poor service that we were providing to this poor guy. So I said, this is BS. I got upset. And I'm mindful of a saying of St. Augustine, who said that hope has 2 beautiful daughters. The first beautiful daughter of hope is anger at the way things are. And the second beautiful daughter is courage to change things. I dropped my practice at the hospital completely and just decided to go into the streets and under the bridges and then start treating people. So I've been out since 2018 doing this kind of shtick. I go out with John Tomino and In My Father's Kitchen, who's a very wonderful partner with me. We founded House Calls for the Homeless. It's an upstate program. I've been draining abscesses frequently. I do it on the street. I've got a go bag that I go out with. The upstate inpatient pharmacy and I have worked on an arrangement where they count the drugs. They give me the meds front loaded and patient name, but I've got baggies of clindamycin and Bactrim and all the different types of frontline antibiotics that I would need, as well as antihypertensive, amlodipine, inhalers. There are people that are experiencing homelessness. They're trapped in addiction. 50% have a bona fide psychiatric diagnosis. Trying to getting them into psychiatric care is a whole other issue. In addition to providing frontline services for the acute medical types of things, I've been able to use services like Molina and other providers that can get these guys on Medicaid. There's not a barrier to getting them insurance. 80% of these guys have insurance, no problem. They don't have a doctor. It's a square peg, round hole thing. So the structure in Syracuse is like every other place, is that we have a construct where you have a clinic setting and you got the patients come in and you see them, the nurse triages, et cetera. This isn't that. And so providing medical services directly and having the physician there with the patient, all I got to do is I got my hotspot with my computer and I'll send electronic prescriptions all over the place. And we also have a very good relationship with Upstate Outpatient Pharmacy. We have an account there through our foundation that we've been able to raise money that will cover all expenses for free drugs for people that aren't insurance or any uncovered medicines. When I started the program, we fundraised with my initial thought of it being, I'm going to need a lot of stuff, a lot of support financial wise to getting meds for these guys. Because I've done a fair amount of work in Haiti and India, Nepal, Ecuador, Puerto Rico, and other places in Kenya. I kind of patterned this after that. So in those places, you had to provide all the drugs to the person and they fundraise to get the meds. And the other big thing I see on the street is toothaches. What would happen is I would see a tooth abscess and I can get them on Clinda and get them started up. And then the dental thing is a big problem, getting them into the dentist. And a lot of these guys are trapped in the addiction, trapped in the psychiatric stuff. So this one person, this 30-year-old woman, I started her on Clinda for a toothache. And we had her set up with a dentist at the time. We were able to kind of beg and plead with a local dentist who was really kind to us to help us. She wouldn't go. Didn't show. We drove her to the appointment. She jumped out of the car one time because she had to score. And so I treated her 3 times with Clinda. And then the last time she was lost to follow-up. Next thing we know, she's in the intensive care unit at Upstate because she had necrotizing fasciitis that tracked all the way down from one of her molars through her neck, fascia, into the pericardium. She coded. She died, basically. They brought her back with a pericardiocentesis, pulled the pus out. So we've been partnering now with a great dentist in the community, Michael Romano out of Summit Dental Group. We got an arrangement with him that acute dental issue, abscess, not screw around with it, get them in. We've got a nice fast track. John Tomino's crew will go out with these guys, get them to the appointment, sit with them in the office, do the thing, and then get a treatment plan for dental. That's pricey. And so that's our next fundraising thing is for hitting up, various places, Dental Association, other good fundraiser givers to give to House Calls for the Homeless. So it's House Calls for the Homeless, and it's with the Upstate Foundation. Donations are greatly appreciated because they'll go to this we're targeting this dental thing as our next big deal. And it's several thousands of dollars. This one patient we have got a beautiful newsletter with a guy with no teeth and a guy with full teeth. And now he's connected with his family. He was really stigmatized and felt terrible about not seeing his kids. And so he's now reconnected with his family because he just feels better about himself with his teeth. I've been vaccinating these guys for COVID ever since last April, and we've had a really good turnout. And then the last thing is I've started to give bridging therapy with Suboxone for heroin and fentanyl addiction. And we've had some really good results with that. And you know, I've become a true believer in it, because even if there's some diversion with it, I realize that for every 3 new prescriptions of Suboxone, you save a life from heroin or fentanyl. I've got a thing in Epic in the COVID mobile immunization clinic under the auspices, but I do everything else under it, not just COVID. Several times a week, what I'll do is I'll take first and second year medical students with me. I'm trying to get them young before they get jaded and get in bad influence, and they can really see this. And I have them with me, and you know, we've had some really inspiring stories, and they seem quite motivated. So that's important for the next generation.
Very good. I think that was excellent. So before I hand over the duties of the presidency to Dr. Dracker, I would like to take a few remarks, or make a few remarks. First of all, thank you all for coming out tonight. You know, I'll be sharing my observations on the past year, which was really quite busy in retrospect. First, Onondaga County Medical Society is still important, and that's really the most important thing to get out of what I'm going to say tonight. It has a very important role in the success of our profession and our ability to advocate for our patients. We're the only voice that speaks for all physicians. That voice needs to be explained to all physicians, both for our continued ability to advocate for patients and our continued autonomy as physicians. Some of our accomplishments for this year, we have been working on the Onondaga County Medical Society, as Troy alluded to, at the state level. Certainly our stuff was fairly antiquated. We redid our website. We updated our membership information to a new database, allowing for easier communication with our members. We also secured a new set of offices located in the David Barkley building at Armory Square on the first floor. Hopefully, as COVID wanes, we can start to have in-person meetings again. This filled a very important role for the Medical Society, which is having a permanent home in a safe and secure environment, something they hadn't had in quite a while. On the local advocacy level, you know, we were very helpful in securing PPE for physicians' offices. We were helpful in securing an organization, Krause Hospital, willing to vaccinate those physicians not affiliated with a hospital system, which for some physicians, actually, they felt it was quite a daunting process to figure out where to go get vaccinated. We raised the need for vaccination in conjunction with Syracuse Community Health Center over a series of events this last summer. We are participating in the Central New York Regional Healthcare Equity Task Force to help with vaccine distribution equity. This task force is under the auspices of Upstate Medical Center. We hosted the annual Ask the Carriers Conference, and then we had some educational programming on the new E&M coding changes that were effective on January 1st of this year. Probably the most significant change in physician reimbursement in the past 30 years. At the physician and statewide advocacy level, Onondaga County we participated with a very strong contingent on Lobby Day. Our participation was followed up by outreach from several of our local elected officials to gain input on several topics that were voted on by the state legislature. We also had very robust and vocal representation at the annual House of Delegates, which I'm happy to say, I think most of us made it to the bitter end after staring at a TV set for 10 hours. So that was pretty good. There are 2 important success stories. One is to echo on what Troy talked about earlier tonight. The first was helping to defeat a proposition to post in the Office of Professional Medical Conduct, or OPMC for short, any complaint against any physician at the time of the complaint before any due process occurred. About 98 of every 100 complaints ended up being unfounded. This saves all of us from potentially practice-ending complaints and allows a due process to occur that we are all entitled to. The second, I think, very profound success story for this year was the defeat of a bill to allow pharmacists to dispense all childhood vaccinations, order lab tests, and adjust medications without physician input. A very real threat on our patient advocacy and care coordination roles. A proposition that really would further fragment our already very fragmented healthcare delivery system. We also spent a large amount of time getting the Medical Society reintroduced to Syracuse. We were meeting with the senior leadership of all the local hospitals, discussing what our role in the community is and what the Medical Society can do to help with their medical staffs, and what the Medical Society has to offer in terms of leadership development. We worked with several local systems to promote vaccine adoption, and meeting with practice administrators and educating them on the role of the Medical Society in the community. Lastly, we spent a lot of time with other physicians, other county societies, and MSSNY on the future of the medical society. And again, echoing kind of what Troy was presenting earlier tonight. The medical society really needs to work more to bring the value proposition about what we bring to the table. That really needs to be explained in a more coherent and succinct way. We need to work on inclusivity and diversity, something that is very important to all of us and more importantly to the younger physicians in our community. We need to expand the concept of advocacy to include more than what happens in Albany. That advocacy needs to include working in our local community to help with access to healthcare, address vaccine hesitancy, and the many other areas that impact the lives of our patients. We need to work on collaboration with other county societies to build a more robust and cost-effective organization. This last point is the most important to help OCMS survive in a very competitive environment for members, and also to provide more leadership opportunities for physicians. We need to work with MSSNY on how they can support local societies with regards to recruiting new members and building the value proposition of organized medicine. We need to do a much better job of explaining our successes and the challenges that face all of us, regardless of physician specialty and work environment. I do have two shout outs for this year. The first is to Erica Berry. As you know, Erica resigned her position as the executive director of OCMS in September of this year. With the COVID epidemic, Erica needs to be able to devote more time to her family. Excuse me. This year, Erica accomplished much, only some of which has been outlined above. Her tenure provides an excellent template for the next executive director to develop and expand upon. She has worked tirelessly on our successes and has been instrumental in the search for our next executive director. Erica has committed to helping the next ED understand what our accomplishments have been and how we view the evolution of the medical society, concepts that need to occur for us to continue its mission and its work. And to Debbie Colvin, who has been willing to help out above and beyond the call for position as the Director of Finance. She organized tonight's meeting, a first for her and really one that's been quite successful. She has helped with the nominations committee, the search committee, the awards committee, et cetera, et cetera. You should all get the picture of her commitment to the medical society, and we owe her much thanks. Her continued work for the medical society will be essential for the new executive director to understand the workings of the medical society and how to build on our successes of the past. In summary, the medical society is important. The medical society is actively working on transforming to a more inclusive and diverse organization. The medical society is working on the next generation of advocacy and building the value proposition to preserve our ability to advocate for our patients and work on the problems of the day in our community. The medical society is working on a new business model to allow it to continue to support all of us. Again, thank you for the opportunity this past year and the trust I have felt from your support. And now it is my pleasure to introduce the next president of the Onondaga County Medical Society, Dr. Robert Dracker. For those of you that don't know him, let me tell you a bit about him. Dr. Dracker is the full-time pediatrician and medical director for Summerwood Pediatrics in Camillus in Liverpool. Dr. Dracker is the past president of the Onondaga County Medical Society. He founded InfusaCare Medical Services, which provides adult and pediatric patients with currently standard and emerging outpatient intravenous therapies. He serves on a number of professional and charitable boards and is presented worldwide on many topics regarding pharmaceutical parenteral therapies, clinical research, and a variety of pediatric policies and stem cell therapy. He is actively involved in ongoing basic science and clinical research, particularly involving vaccine therapies, and as well over 50 abstract and article publications. And now it is my pleasure to present the 194th president of the Onondaga County Medical Society, Dr. Robert Dracker.
Thank you, David. I'll try to be as brief as possible because I'm tired. I'm still dressed because we had a COVID clinic for kids tonight, and I'm so tired of COVID. But let me cover my comments, and please ask me any questions at the end. First of all, thank you for entrusting me again with the efforts to lead the Onondaga County Medical Society during this upcoming year. First, however, we need to recognize the patient, wise, and steady guidance of Dr. David Page, who has been your president also for his second term over this past tumultuous year. I would also like to thank Erica Berry for her exemplary role and commitment to the Medical Society and its members over the past 2 years. She has continued to guide us and is facilitating the search process for a new executive director. Not always considered by our community, the Medical Society represents an organization of physicians who collectively uphold the principles of commitment and caring for the patients and families who live in Central New York. Those who endeavor to serve on the board and as officers of the Medical Society do so for no other reason than to ensure the interests of their colleagues and those that they serve. By nature and by design, physicians are leaders in all aspects of their own lives, a characteristic clearly exemplified by them during these uncertain and chaotic times. As much as some of us might deny, physicians are human, however, not unlike the patients we care for. We have experienced personal and professional stress, financial hardship, and some have reevaluated their own priorities, causing them to leave the profession earlier than previously considered, and others to change their practice circumstances and venues. For most physicians, it's been recently acknowledged that we have experienced increased professional and personal stress and disappointment, as well as decreased career satisfaction in ways we never anticipated. For the most part, however, we have endured these previously unexperienced times to emerge intact, but in a new and different reality. We've transitioned to incorporate a virtual, Zoom-like based reality for meetings and professional interactions, like tonight, obviously, and have distanced ourselves from some of our patients, resulting from the use of telemedicine platforms. Whereas technology has assisted us in dealing with the segregated and isolated aspects of our new reality, it has also changed the nature of our personal and professional relationships. Unfortunately, to a degree, we have witnessed an era of professional apathy and fatigue, seen not only in organized medicine, but also in our relationships with each other. Changes in access to healthcare because of the pandemic have burdened our practices and hospital institutions with addressing access to care issues. Emergency rooms have been paralyzed due to overwhelming patient visits and limited inpatient bed availability due to maximized census, bed closures, and limited staffing. All of us have recognized the shortage of healthcare workers at every level, causing a contraction of services and diversion of patients out of our area. I, like many of you, feel personally toasted, which is, by the way, the stage before burnout, resulting from political unrest, displays of bad behavior, limited supplies of office PPE, COVID mutations, COVID testing confusion, vaccine misinformation, mask wearing, modified social distancing, especially at holiday time, and generalized social pessimism. So on that sullen note, I propose that we recognize and embrace opportunities for optimism, growth, and professional evolution based upon improvements in communication and the acknowledgement of healthcare provider needs and values, utilizing technologies and collaboration with our colleagues, both locally and in our surrounding environments. Many of you are not aware of our new office location, as David mentioned earlier, at 125 East Jefferson Street in downtown Syracuse, which is in the lobby area of the Barclay Damon building. Not only does it provide us with tremendous visibility and access, but affords us with meeting and gathering space in the adjacent lobby and on the rooftop area, weather permitting. We can also utilize a beautiful and well-equipped classroom space, which will be available for both professional office staff educational opportunities. This new office space was secured through the efforts of Erica, as well as the generosity of Mr. Charles Sangster of CBD Companies. A main priority of our society will be to develop and communicate the value of our membership and to make every attempt to return membership to one which has always been considered an honor to belong to. We must demonstrate true advocacy for our members and find ways to appeal to our younger colleagues who need to be engaged in our mission so that we can ensure the health and welfare of our community. Chaos, change, and uncertainty can be crippling to some, but to physicians as leaders, on behalf of our patients, institutions, and practices, we need to respond with newfound commitment, creativity, and activism. Risk-taking options with the intent of improving outcome is something that we all do on a daily basis, endeavoring to assist those who depend on our care. We need to collaborate and engage our local healthcare institutions, insurance entities, and regional organizations who will all need to engage with each other for the betterment of our community. I'm hopeful that we will explore new ways to interact and share each of our strengths and assets for the benefit of all. The success and survival of the society will depend on member engagement and involvement. Our board is not just the few who appreciably take their own personal time to assist our mission, but is one which is made up of all of you, of which we rely on to participate and guide us. Thank you for allowing me to have the opportunity to be your president again. And I look forward to a very exciting, successful future for our organization for many years to come. Thank you. David, we can't hear you, David.
You think after all the gazillion Zoom calls I've done, I'd be a little bit more facile tonight, so I apologize. Thank you, Dr. Dracker. We sent you the traditional gavel that symbolizes this transition. You're supposed to hold it up. There we go. We look forward to your leadership in this critical year for our profession and our community. And there you go. Good night, everyone. Stay safe. And thank you for this opportunity for the past year. Bye-bye.
Thank you for everything.
Thank you, everybody.
Thank you.
Thank you.
Thank you.
Thank you.